Okay, folks, we will now start the roundtable. I think you know the people who are sitting there. We have all been here. Anyone was not here this morning that needs an introduction of these people? We start at the end as Elder Later from Inter-American Division, the GC team over there, the Associates and Director, and Loma Linda University, Dean of Public Health. And I am just Belkis' husband. I'm doing what she told me to do, so stand here and not do anything else. Are they translating someone? ¿Alguien está traduciendo, por favor?
Yeah, the French is being translated.
Okay, I'll do all three languages. Good afternoon, buenas tardes, bonsoir. And that's about it. Yes, we have translation. We'll do this in English. Translation will be Spanish. Por favor, los de español, pónganse su equipo. Vamos a hacer el programa en inglés. Ready? Okay, we went over your questions, and we have the questions here. And because of time, I'm going to ask specific people. Pardon me, folks, if I direct questions to you, but I think I know of all of you for a good time now, so I more or less can decide. So I want to start out with Elder Lato. We have been talking this week, at least I've been hearing, about the importance of health, and someone obviously was impressed by this, and they wrote a question that said, should we strengthen the fundamental beliefs in the church manual with the health message and the strategy of serving and healing from our vantage points? In other words, I think what you're trying to say is, should we include in the health manual, in the church manual, something regarding the importance of health?
Definitely so. Furthermore, Dr. Archibald, the fundamental beliefs have come to represent more than the church manual. It is where the church defines its doctrines, its beliefs. These are the things we stand for and we are ready to die for. And I believe the health message, as from always, has had that position among us. Some have seen the health message as something optional, but it is not as optional. And I certainly believe it should, I don't know how we can formulate a doctrine called health message, but something should be done, and I fully agree with the concept. Once it is formulated as a doctrine, one of the fundamental beliefs, then certainly it must make its way to strengthen what is in the manual already, so that people will start looking at it more than an option, but this is what Adventism is all about.
Thank you. Got your answer? Hope you did. Okay, I want to move on, and I have a second question. I want to direct this one to Dr. Tricia. Someone said, is faith sufficient to heal? And what does science play in the role of curing? Of course, I heard Dr. Rodriguez said that from a theological point of view, healing and curing are two different things. I think we're talking about curing from a medical point of view here. What would you respond to that question?
I believe when we are Christians, faith plays an important role in everything we do, whether it's health or sickness, decisions about our families, professional decisions. Everything we do needs to be by the faith we have in God and what we believe He wants us to do. I believe also that our faith must include knowing that when we pray for something, we won't necessarily get the answer we're asking for. So it's not a mathematical equation where disease plus prayer equals healing, but that there are many different factors that come into healing, and that sometimes God's will for our life is not that we be healed, but that through the sickness, our salvation or someone else's salvation may come through. So I think that that is a basic understanding that we all need to have. Faith plays a role in every aspect of our life. Faith doesn't mean that we will be automatically healed because we say we have faith in God.
So I want to come directly then.
Yes.
As a Seventh-day Adventist, it's not wrong to visit my doctor.
No, and that was the second part of the question.
Sorry.
No, that's okay. The second question that was there. Medical institutions were, Adventist medical institutions were placed there by God with a purpose. And He specifically asked for medical courses where the students could answer any qualifying exam from the government to be able to practice medicine and be recognized as physicians in every sense of the word. That tells me that he values it and that he has wanted to have Christian medical professionals, physicians, nurses, nutritionists, that have that faith in him to be able to also address the health needs of his people and of everybody else. So to answer the question quickly, I believe, yes, there is a role for medical professionals to play in the healing of Christians and non-Christians because they are fulfilling Jesus' healing ministry here on earth.
Thank you very much. I want to continue that line based on what Elder Lato said. Dr. Handyside, someone said that health reform, the term health reform, is kind of an old terminology. That maybe we ought to do something according to the postmodernists, change the name, get it actualized, get it in the spirit and the grooving. What do you think?
Well, it's quite true that health reform is somewhat an old-fashioned term. Actually, health reform existed before our church. There was the health reform movement, just like there was a temperance movement, before Seventh-day Adventists even existed. So, yes, it is an older term. It was a term that Mrs. White has used and picked up to indicate those who are seeking to change their old habits that lead to disease and sickness and reform their lives and bring them into conformity with the natural laws of God that will promote good health. Now, nearly every Adventist who has been an Adventist for a little while understands health reform in that terminology. I think perhaps when we're dealing with the public, we might be wise to use that word a little less strongly and to talk about health promotion and to talk about lifestyle changes. And even when the secular groups are talking about non-communicable diseases, let us talk about non-communicable disease. Language is not sacred. It's the principles and the concepts that will last for eternity. But we mustn't get tied up so tightly with language that we bind ourselves. There's a word called anachronistic. And there is a danger that we become anachronistic. We only have to look at the Amish, or we perhaps look at people who will only ride in a horse and buggy. And we look at them and we say, there's something strange about this. Although I'm very pleased to say that some of those religious communities who still stick to the horse and buggy find it quite all right to sell their goods on the internet and to use iPhones and iPads and things that are technologically much more advanced than the Model T Ford was in its day. What we need to do is to realize that Jesus came and he ministered to man's necessity. It's not in the sacredness of a term. It is in ministering that we really serve the Lord. And if we can look at the writings of Ellen White, recognize that they do come from an era that is different from our own, and realize that some of the words have changed. One classic word that has changed, she said that we should be happy and gay. And that's a word that has changed its meaning. So you know, we have to be careful that we don't promote that people must be gay. But they do need to be happy, you see. And that's what you have to understand. Language changes with usage. And over the space of 40 or 50 years, language changes. I hear people saying we want to be notorious. Well, when I was learning English, notorious was a word that meant famous, but for bad reasons. And so we don't want to be infamous, you know, so we have to understand language. Now, do we need to introduce other terms? Yes. we need to introduce other terms. You know, we talked about every church a community health center. Somebody said to me, well, health center means a hospital, it's got schools, it's got all kinds of things. So maybe we say, okay, if you're going to use it in that interpretation, every church becomes a center for health promotion. It's the ideas that we must promulgate, not be so tied up with the words that we tie ourselves in knots.
Thank you very much. And now that we continue talking about postmodern area, the area of the internet, the cyber, Dr. Kuntaraf, there is a concern. What in your trainings on youth alive and relationships, there's something very popular today known as cyberbullying. I hope the audience understand what it means. How do we deal with the victims and the perpetrators from a Christian point of view? Is there something that you can tell people who tend to bully others?
Okay. Whether it's bullying in the cyberspace or bullying in the physical world, this always shows that the persons are insecure. They like to put people down so that they will feel greater. And so we as a church respond by training them to use the principles of Youth Alive, where everyone has to be treated with honor, dignity, and respect. But we cannot tell the young people, hey, love one another, respect. They don't know how to do it. So we do it by playing activities that get them connected to one another. And we always stress the point, in order for us to get connected with one another, to support one another, to love one another, esteem one another, we need to have the right relationship with God. If we don't have the right relationship with God, we will not value everyone the same. We will just look at people, oh, they are rich, we will honor them. If they are poor, forget it. We just don't look at them. But then again, we always stress the point that if you look at the foot of the cross, it's a level ground. There's no PhD, there's no uneducated people. And so we do not bully people just because they are uneducated, but we will treat them with honor, dignity, and respect, because everyone has the same price tag, that is the blood of Jesus Christ. So we can genuinely help one another. We can truly esteem one another, not fakingly, but from the heart. That's how we train. In the General Conference, we have 4 departments that launched this Youth Alive program. It's the health department, because it's the young people that have drug problems, and it's young people, so it's a youth department, and also it's in a school setting, so it's with the education department, and also because young people belong to the family, so it's also with the family department. So 4 departments work together to launch the Youth Alive program, because we value our young people. We want to save our young people so that they will not go out from the church.
Thank you. So you can do health ministry on the cyber space also.
Oh, yes.
Okay. Thank you. Now I want to go into something, it's a concern of a lot of people that there were several questions on this, so but turn this one up. Dr. Harding, this one is for you. Is it true that vitamin B is only obtained from animal sources? B12, yes, there are several Bs. Or is it possible to obtain the same quality from other food sources or vegetables?
All right, that's an excellent question, and we hinted at that this morning. Actually, more than hinted at it, but in our skit. But vitamin B12 is found only in animal products. There are no known vegetable sources, even though there are some things that have been claimed by some to be equivalent. They are not, and they don't have the biological activity in the human that the animal sources of B12 do. So for those who are total vegetarians, that is, they use no animal products whatsoever, it is probably the primary nutrient of concern. And fortunately today, we have many alternatives, sources of true B12. And a supplement is probably the easiest way of doing that. And so the recommendation from the organizations that the nutrition organizations are very clearly that those who are not using any animal products should be taking a vitamin B12 supplement on a regular basis. They can take that orally, they can take it sublingually. We only absorb a small portion of the supplement, so even though the body's needs are relatively small, the supplements are fairly large because we only absorb a certain amount, a certain percentage. It can also be taken intramuscularly in an injection, but a lot of people don't particularly care for that. And that can probably be done on a monthly basis in most individuals, if they choose to do it that way. So the total vegetarian needs to be aware of that. Now there's some other sources today that are readily available in the food supply in a lot of the world, and that is fortified food products. Whether it's fortified soy milk, and certainly in the US and countries that are using the US manufactured ready-to-eat cereals, they're all fortified with vitamin B12. The soy milk is fortified, and so it's not that difficult to get as long as you're consuming those foods that have it. Nutritional yeast, brewer's yeast has none in it, but there is a brand of yeast that is marketed as nutritional support yeast. You need to read the label, and it is grown on a B12 enriched media. In other words, this yeast that's grown has to be grown on something, and they inoculate that media with B12, and by contamination, really, those yeast flakes have vitamin B12, and they're a good source also. And then, of course, when we're talking about B12, we have to realize that you know, if you grow your own vegetables and you don't wash them really well, the little creepy crawlies that get in the salad, they're rich sources of B12 also. But in all seriousness, it is a nutrient that those who are total vegetarians need to be very concerned about, and need to just, well, maybe not concerned, they just need to make sure that they're getting an adequate source of it. For the lacto-ovo vegetarian or the pesco-vegetarian, it's not really much of an issue because milk, eggs, and fish have B12 in it. And for those who, and in reality, small amounts of milk and eggs also provide an adequate source of B12, and that can be a supplementation for B12 in an otherwise total vegetarian diet, or close to a total vegetarian diet. So there are different ways of doing that.
Thank you very much. Dr. Landless, I want to follow on that line in terms of your area. And how do you manage hormonal disorders, stuff like hypothyroidism, with a vegetarian diet? And in addition to that, what's the church opinion on these other practices like iridology and homeopathy and all the other type of non-traditional medical treatments? What can you say to the curious listeners on these two things?
Well, you and I used to be good friends until you asked me this question. Let's go with the easy one first, although they're both relatively straightforward. The question on a vegetarian diet and the treatment of hypothyroidism or an underfunctioning thyroid gland is the same in the vegetarian and the omnivore. If the hormone is lacking, which is thyroxine in the case of thyroid disorder, we replace thyroxine in the individual who's a vegetarian. The question, though, may not be as straightforward as we think it is, because when one is a vegetarian and a plant-based diet, which is many of us sitting right here, there are substances in certain foods which are what we call goitrogens. A goiter is when the thyroid is enlarged, so a goitrogen is something which causes thyroid dysfunction or a decreased ability of the thyroid to absorb iodine. Now, in that setting, one of the important components of this question is the fact that certain foods, there are fads about foods. Some people say you've got to go on the raw food diet. Well, one of the important reasons to cook certain food substances, including certain legumes and so on, is that the cooking process inactivates certain of the goitrogens. So that would be a component to the question. But we do not treat diseases of hormonal origins by a vegetarian diet. We use a vegetarian or a plant-based diet because that is the best diet to use. Then in addition to that, if people get these diseases, which we will do, as long as we're on this planet until Jesus comes, we will be subject to many of these diseases. So then we supplement the appropriate hormones when we need them. An additional comment, though, some people are worried about the soy, the Genenstein in soy, that was a Freudian slip, wasn't it? In soy, and whether or not that can be a problem affecting the fertility of men, increasing problems in women and breast cancer, generally not. The issue of, for example, the Genensteins, they have been shown, particularly in studies in Japan, that in women who have had breast cancer, when they are exposed to the soy products which have these substances in them, they often have better outcomes. So it's a complex issue, but I would like to leave the bottom line that when one is on a vegetarian and a plant-based diet, one will possibly face fewer diseases, which is what we've seen from the Adventist Health Study. And that's the way we ought to go. When we have illnesses or diseases associated with living on this earth, related to our genetics and our environment, we take the appropriate medication or the replacement therapy which the good Lord has given us through medical science. To come to the question on the Church's opinion on non-traditional treatments such as iridology, homeopathy, and a number of the alternatives, you didn't mention exhaustive list, but two were mentioned specifically, homeopathy and iridology. But I'd like to back up just very briefly. The Church doesn't have opinions. I don't know if you heard what I said. The Church doesn't have opinions. Secondly, the Church is not the conscience of the individual. But the Church has a working policy. And in the working policy, in the health ministry section, there is a very clear component to the policy which states, it was voted at the annual council with the World Church in session, that our health practices are based on three fundamental foundations. Number one, the Bible. Number two, the spirit of prophecy. Number three, peer-reviewed medical science. If a practice, a therapy, an approach to health is judged against those three and it stands up, then it's acceptable to be used. It is promoted and would be blessed within our institutions, promoted among our churches, and we would go ahead on those. Now, there are two that were mentioned here very specifically, and the first one is iridology. Iridology, stated in that policy, it's named because of the lack of evidence for the field or the practice of iridology. We do not support it. Homeopathy, there was a very, very interesting and helpful study conducted in the Lancet Medical Journal, or reported in the Lancet Medical Journal some years ago, where homeopathy was studied in depth. Homeopathy, now I want us to remember, so many people confuse the various kinds of so-called natural remedies and natural healing. We're talking about homeopathy, where less is better and where you can impart energy to little molecules. Water has a memory. So in other words, every molecule of water has a memory where it's been, and goodness knows whether the lentil soup had water in it that had been in some horse's kidney some time ago. I'm not sure of that. But seriously, the homeopathy was studied and shown to be no better than placebo. No better than placebo. Placebo means, and many of you are health professionals, but placebo, if you give someone who's got a headache a white tablet that looks like a Tylenol headache tablet that's made of sugar, or you give them a real Tylenol tablet, it's shown that probably 30 to 50% of people, if you give them a sugar tablet for their headache, will say, "Ooh, I feel so much better." But placebo effect has been shown to be mediated by hormones called endorphins and belief. Now, there's nothing wrong with belief. There's nothing wrong with endorphins. But just be sure that your placebo doesn't cause harm. So placebo effect, homeopathy has been shown to be no better in very rigorously conducted European studies in the home area of homeopathy. This was not popular when it came out. It is still not popular. It is not popular in our church. And part of the reason for that, the findings of these studies sometimes fly in the face of our pet theories. We love evidence that backs up what we want to believe. You know, if we read in the articles and someone's going to talk about that chocolate's good for you, we say, "Praise the Lord, bring it on. Let's publish it in the Review in the Adventist World." But we need to look at the verity and the power and the significance and how the studies have been done. So we need integrity in our interpretation of the studies. So in answer to your question, there are many of these. They are listed in the working policy of the General Conference. Do we go onto delicate ground when we move into areas of pendulum swinging, on iridology, on meridians, on the acupuncture, chi, and so on? Yes, we do. And I'll share with you very briefly as I'm going to close my portion of this panel, and that is that my late father was a very, very strong Christian, a very strong leader in our church, but started to do karate, became the top qualified Westerner in his style of karate. And everybody encouraged him, but along with that came an acceptance of the philosophy, which caused him to lose his way. I think, and that's anecdotal, but to me remains a very, very strong reminder that we shouldn't fiddle with New Age, with alternatives which are founded in mysticism, which are being promoted in areas where, you know, it's often very innocent. Aromatherapy. It's aroma pampering. I love lovely perfumes and smells. It's not a therapy, it's a pampering. Because a therapy means that it's going to treat something. So let's be very careful how we approach and apply, because the devil is out like a roaring lion, seeing whom he can devour. We need to be careful.
Thank you. We're still friends. Now I'm going to lose another friend because I'm going to go to Tricia. I am a vegetarian. I follow all the rules and everything, and then I go to my doctor and says, "Okay, you have a cancer. You need chemotherapy." And I'll go home and say, "That's God's will. Forget it. I'm not doing anything." Maybe I go to my neighbor and get some aromatherapy from him because prayer didn't work. And I got to take chemotherapy. That's chemical stuff. Or radiology. What do you think?
My second son was diagnosed with cancer when he was 3 months old. And what I'm going to share with you comes not only from my perspective as a physician and public health professional, but as a mother. And when we discovered it, we were sent first to a Seventh-day Adventist physician who wasn't there. And then we were sent to another physician, a Christian but not Seventh-day Adventist. And the first thing she told us, she met with the whole family, was to say, your faith is going to be what pulls you through this. The second thing was, put blinders on like you're a horse. And she did her hands like this. And she said, there's going to be people who will come to you and give you all kinds of advice. Drink this tea, take them to this place, bury that piece of clothes. Don't listen to anyone. The team you have here is a team that has trained for this. Pray to God and listen to what we have to say. And after 1.5 years of chemotherapy and surgery, my son was declared free of cancer. Praise God. And he is going to be 10 years old in April. When the whole process started, a pastor visited us in our home. And he said there are 3 ways, at least 3 ways, that God can choose to answer a prayer for healing. He said, number 1, he can do touch and be healed. He still does it. Number 2, he can use medical science. Number 3, he can wait for the resurrection morning. And you need to be ready to accept any of the 3 he decides to use. My advice for anyone who is going through cancer and is wondering if chemotherapy or surgery or radiotherapy is going against our principles because we believe in God and have faith, is that no, it doesn't. Vegetarian diet and our lifestyle will help to support and augment and strengthen everything that we need to have to come through the cancer. We need to have a healthy diet. We need to be able to do exercise and all of those things. It will strengthen it. But we need the agents, the chemotherapy, the surgery, whatever is there to remove the cancer. Is there evidence that there are certain types of chemotherapy that affect other parts of the body or radiotherapy? Yes, there is. But you know what? That extra week or month or year or years that that person has on this earth because of the treatment and the ability of that person to take care of her children till they finish school or to be able to touch other people's lives is important. You can't steal that away from someone by not doing anything. So my advice would be, whatever you go to a physician that fears God, and whatever advice that person gives, follow it, follow a healthy lifestyle, and number 1, God heals. He's the one who can use any of those methods to bring healing or not, depending on what his will is. And we need to be ready to remember those. There are some people who take it upon themselves to visit the different fields of the church and bring some advice that is sometimes extreme, talking about certain types of water you shouldn't drink, or shapes of things, or colors of vegetables or fruits, or usually it's one pet theory that is extreme. And they visit our churches, invited by us, and bring the message, and then there's people in the congregation who will easily follow something because it's spoken from the platform. Please be careful in who you invite to speak to your church from the platform, because you need to be sure that those 3 things that Dr. Landis talked about, the biblical foundation, the spirit of prophecy, and evidence-based medicine, is in the advice you're giving your members.
Amen.
Okay, now we mentioned something here. For the people from the English-speaking Caribbean, Obia no good.
Yep.
The rest of you don't understand that, don't forget, don't worry about that. Dr. Kundaraf, now that she mentioned something about the church and bringing people to speak at your church, your pastors are key people in this process. Is there something that's been done to get the pastors on board the health medicine, the health reform process, to facilitate it, or not to block it? I don't want to say that, but you understand what I'm saying.
Yeah. You know, we from the General Conference, Health Ministries Department, have been doing training in a master's level for 3 divisions in Africa. That is West African Division, and then the Southern African Indian Ocean Division, and the Eastern Central African Division. We taught them, Dr. Handy Sides, Dr. Landers, Dr. Harding, and myself. We have taught them 88 lectures. First about the anatomy, physiology, so they can understand why we function, so that they will not promote urine therapy. You know, we know that urine therapy is a waste already. Why do you use that to drink? That's all not evidence-based. So when we train them, in the beginning, they were not happy. Because the division presidents and the officers says, you have to take this training. They were not excited about it. What is this about the training? But after the training, there are so many pastors said, we are so thankful because it's changed our ministry. We understand our body and we can promote the health message. So instead of blocking it, because when you block it, it's because something you are not sure of the message. But once you understand it, then you will be able to promote it. So I wish if there's an invitation for the Inter-American Division, I'm sure we'll be happy to do that, the same thing also with the 3 African divisions.
Thank you. I didn't lose you as a friend, right?
Say it again.
I didn't lose you as a friend.
No.
Okay, then I'm going to lose another one because I'm going directly to the president of Inter-American Division now.
Bring it on.
How do we get health directors at every level of the church? Is there something been thought about, been considered, not considered, or impossible?
Carlos, you have lost a friend.
1, 2, 3. Still got my wife and my grandkids, my son, no problem.
Well, brethren, it is the age-old issue to put as many people as possible to sit in an office with a title. And this is not possible. However, it doesn't mean that the ministry cannot function, because just one person sitting with a title on his desk does not make it a ministry. There are other ways of getting it done. And I believe that at all levels of church, we should have somebody to promote healthful living. In the division, we formulated this policy, and we said, not a policy, but this practice. We said, look, folks, we need health teachers. We need people to promote healthful living. And therefore, we went out and we looked for the best we have to put in that position at the division. And so we are promoting it also in all other levels of the division. If money becomes an issue, because in many of our local fields and our unions, they cannot afford to replicate the General Conference literally. Having all the departments staffed by 1, 2, or 3 persons like at the GC, but at least to have somebody. And this is the issue where we have found ways of still doing things without having a person definitely sitting at the desk and once in a while go out and preach a sermon on this. We use professionals, we use lay people who are very knowledgeable of the topic. We use persons who are working at a level, let's say in a conference, who is a health professional, and we also use them in a union position, so they wear double heads. Hats. We have found creative ways to make sure that from the local congregation up to the division, there is somebody doing health ministry training at all levels. We cannot afford to have all sessions elect a person specifically for that, but we try to at least have somebody doing it. The problem is, however, and I have had to go through this so often, they say, okay, let's define the most important departments. Mistake number one. And once we have defined youth, personal ministries, Sabbath school, then we'll say, okay, fine, let's assign the other departments then to anybody that comes along. You have chosen 3, you have chosen 4, and so you need to assign health to somebody, and then you give it to somebody who knows nothing and will never do anything. I would rather not assign it to such a person and would rather go out and find a layperson who is willing and able to do it and say, okay, we cannot afford to put you in salary, but you have travel, you have a stipend, you have access, go and help us in this area. And so it is happening. I believe somebody should do it. To have a paid person doing it at all levels, I don't see it in my lifetime.
But you would recommend that?
I would recommend that it be done by somebody who is knowledgeable,
And if it's
qualified.
a
to do it.
volunteer,
Even a volunteer.
treat them nice, keep them in there,
Exactly.
because it's right hand of the ministry.
Definitely.
Good. Thank you so much for that. Now, we have a few more things. Time is going, and these are a couple of questions that Dr. Harding, Dr. Handyside, there is a question for you here because it comes up your line, and remember the years you practice obstetrics and all that stuff, can't even pronounce it. But it says, is there anything a young pregnant woman can use to nutritionally reduce the growth of fibroids? Pregnant person coming up with these.
Well,
benign
first of all,
tumors.
for the gentleman here in the audience, we need to tell you what fibroids are.
Okay.
The word fibroid sounds as though it's a benign tumor of fibrous tissue. That's a misnomer, because in actuality, what we call a fibroid or a leiomyoma is a smooth muscle tumor. Typically, it is found in the uterus. When I say typically, that is because it can be found, a leiomyoma can be found in other places than the uterus. I would imagine that the interest in this particular type of tumor is present here because we have some people who are of African descent, and it appears as though the African woman is slightly more at risk of leiomyoma or fibroids than are some of the other ethnic varieties. But let me tell you, leiomyoma are very common in every ethnic group. Now, it's true, when I was in Africa, I sometimes was up to my elbows in taking out fibroids. They look like a potato. Some of them are as big as the tip of my little finger, so they are new potatoes. Some of them look very big. I've removed them as big as my head. They can grow, and they can grow singly, or they can grow multiply. I remember removing 32 fibroids from one woman's uterus. Many gynecologists would say that's a futile kind of thing to do because you've virtually removed the uterus. Yes, and yet I always believed in treating the whole person. And the person comes with lots of cultural baggage and comes with lots of desires to have children and so forth. So I would often bend over backwards to try to accommodate that woman within the context of her system of beliefs. Now, a pregnant woman is at risk for the growth of leiomyoma. So a woman may have a fibroid the size of the end of my thumb, and during a pregnancy, that fibroid may grow to be the size of a sweet potato. What is it about pregnancy that's making it grow? It appears to be the hormones. This is a hormone-dependent growth. The hormone does not cause it, but promotes it. Just like fertilizer doesn't make corn grow in your patch, but it promotes it if you actually plant the seeds in the ground. So if there is a predisposition to fibroids, the hormones will help them to grow. In pregnancy, they grow very large, very quickly, and sometimes grow so fast that they outstrip the blood supply. and the center of the fibroid may die. And as it dies, it creates and releases substances from the dead tissue, and that creates an inflammatory reaction, and a woman may have an extremely tender uterus with leiomyomata in pregnancy. In addition to the pain, sometimes the uterus can become irritable. And I had a patient, she lost 3 pregnancies with a spontaneous miscarriage or abortion. She just lost it, and she had a fibroid. And at the final analysis, I said to her, you know, I can operate and remove that fibroid if you wish. I can't promise you that you will have a normal pregnancy afterwards, but we could give it a try. And so I took her to the operating room, removed the fibroid, and this was in the days before the laparoscopes, because nowadays we can do some of these things through laparoscopes and minimal access surgery. And I removed that fibroid, and what a delight it was for her to deliver first one and then another child. And she came to me with photographs for many years showing me the development of those 2 children. So to have fibroids is not the end of childbearing. It is a potential problem in childbearing. There are surgical approaches that can be used. There are injection processes. You can embolize them. There are very many different methods, but you need to take each case and treat it as an individual case, because every person has a different set of circumstances. Now, the question, of course, is there a dietary background to fibroids? I have heard very zealous vegetarians say to meat eaters, if you didn't eat meat, you wouldn't have fibroids. It's the animal passions in the meat that are going to make you have fibroids. Well, that is the animal passions in the human that is speaking, that wants to impose their zealous beliefs on another, because we don't have evidence for a statement like that. And it's those kind of things that we try to wean out of our health message, so that our health message is balanced, so that our approach is accepting, so that we treat everybody, as Kathleen said, with honor, dignity, and respect, and we do not impose our own particular biases on someone who is engaged in a process of exploring medical options and therapeutic modalities with her specialized caregiver. So I think that's about enough to say.
Thank you very much. Appreciate it. Now I would go back to my good friend, Dr. Landless. We're still here. This is an easy one for you. Diabetes, alcohol. We know we call these diseases. Are they reversible? Is there any evidence, scientific studies that show that they can be reversed?
Well, yeah, we've always been good friends, and it'll stay that way.
Good.
I think let's start with probably one of the easier ones, because we've had extensive talks on diabetes, and I initially, 10 years ago, was worried about the term of reversing diabetes. But there is more and more evidence to show that diabetes can be reversed. I like what my good friend Dr. Hans Diehl said. He entitled his talk, Disarming Diabetes. Because that's basically what we do. When we follow lifestyle interventions appropriately, the diabetes is put to sleep. It's put out of the way. And many of the processes reverse. And that's a great thing, provided one stays on the lifestyle. It's almost like once saved, always saved. Do you believe that? No. I do, as long as you stay saved. Once saved, always saved, as long as you stay saved. Diabetes can be reversed so long as you stay on the intervention. So sure. And with that, many of the complications can reverse. However, we need to realize with diabetes the way it is, it's one of the leading causes of blindness. It's one of the leading causes of kidney failure and renal dialysis. So there are certain points that are reached in this disease where you can prevent progression, but you don't always get reversal. Thankfully, God has placed in our organ systems a tremendous reserve system, capacity, so that there is possibility that, for example, when the excessively high blood sugar is brought down to normal, the so-called hyperfiltration of the increased sugar going through the kidneys decreases the damage to the basement membrane of the kidney, so you get less protein loss, less progression of the damage, hypertension can improve. So yes, there is evidence to show when diabetes is controlled, when it's well controlled, number one, medications can be decreased or even abandoned unless they are what we call insulin dependent. Many of the complications we mentioned, hypertension and progression of disease, can be halted. One thing that is a real bugbear, and in all of these conditions we're talking about, prevention is the cure, and that is nephropathy. Once a nephropathy, a diabetic nephropathy, is established, there may be some decrease in the symptomatology, but it's a very, very difficult condition to manage and to treat. And you don't reverse a gangrenous foot, unfortunately, although there have been some that are on the verge that when one does really intensive interventions, that there can be some changes. To get to the point on tobacco, within 24 hours of stopping smoking, there are immediate changes which can be measured in the body which take place. The cilia begin to function better, the lung capacity begins to improve, what we call the vasomotor reactivity, the way that the arteries and the response of the arteries to the nervous system and the hormones in the body begin to improve. And that improvement continues as long as life is there. However, when there is an established chronic bronchitic picture, emphysema, the emphysema often is at a stage where it doesn't reverse. However, the complications, the increased irritation because of the tobacco smoke, when that is withdrawn, you get a decrease in the number of the evidenced complications which present. So it's never, and we shouldn't say never, but I would say we should never say it's too late to stop smoking. And I think that I would stand by that, and I think the health educators would agree with me on that. When it comes to the issue of alcohol, alcohol is a toxin, and there is not one system of the body which is spared. There is a body of evidence which shows in diabetes, in Alzheimer's, but particularly in coronary artery disease, there may be some benefit to moderate or small doses of alcohol. However, one needs to remember this is a pixel of benefit in a huge picture of a dangerous, damaging, destructive agent, which is addictive, involved in the fatalities of motor vehicle accidents, domestic violence, trauma, and so many other issues. It is to be avoided, and as Seventh-day Adventist Christians who are doing a grace-filled health ministry, the primary reason to avoid alcohol is a spiritual one, because God's Spirit speaks to us through our frontal cortex. As far as it goes, as far as reversing the fatty liver of alcoholism, yes, when you withdraw the alcohol over time, much of that can recover. When it comes to the cirrhotic process, once cirrhosis is established, there may be a decrease in the progression, but the cirrhosis is there. So we need to realize that our job is to get out on the preventive issue and work as hard as we can.
Thank you very much. Our time is gone, and we have just one last question. I'm going to be quick with that. Dr. Harding, is soy good for you or not?
That's a very good question, and it's a hot topic right now around the world. I think it's important to recognize, and without spending a lot of time, and Dr. Lambliss kind of laid the groundwork on that, soy contains some estrogenic substances. Concerns or questions have been raised as to whether maybe those estrogenic plant phytoestrogens specifically found in the soy, and soy is very rich in them, might in estrogen sensitive women that have estrogen-sensitive tumors might increase the risk for breast cancer. Secondly, there was some concern that little boys who were raised on soy foods might have problems in becoming real men as a result of eating the soy foods because of these phytoestrogens. The bottom line on that really today, based on the evidence that we're aware of and the studies that have been done, is that the phytoestrogens in soy are not human estrogens. And while they have many beneficial and preventive aspects to them in humans, today the organizations that make nutritional recommendations are very clear that even post-breast cancer, post-prostate cancer, that moderate amounts of soy are not only safe, but may be beneficial in preventing. And then, of course, I think it's often very, very helpful to take a global perspective. And there are populations of the world, particularly in Asia, that have traditionally been eating much, much larger amounts of soy than we do in this part of the world, and they have lower risks of the things that soy has been accused of increasing, the risk for those things. So I think that based on everything that is understood today from the evidence that is available, it's a safe product. We also need to remember that in Adventist Health Study 1, and we don't have results on Adventist Health Study 2, that those who consumed the meat analogs actually had lower risks of several of the key degenerative or chronic degenerative diseases. So again, balance is very important. And can you eat too much of even good things? Absolutely. And can you eat too little? I think that soy is a safe food. I include, and particularly the soybean. I wouldn't worry about it in any reasonable amounts.
Thank you very much. Well, I lied. I have one more question, and it's the last one, and it's a more difficult one. I'm going to start from the corner over there later. Okay. I really don't care about enemies anymore. What's your favorite pastime?
My favorite pastime?
Yes. Quick. It's got to be quickly. Hobby.
There are so many. Music, reading.
Okay.
Yeah.
Thank you. Dr. Harding, your favorite pastime?
Hiking.
Okay. Dr. Lander.
Scuba diving.
And the slides.
Music and bird watching with my wife.
Tricia.
Playing with my boys.
Okay. Here, your favorite pastime?
Hearing classical music.
Now you know more about them than you did before. Thank you, folks. We had more questions, but the time is over. Thank you for your audience. Panelists, thank you so much.